Hello, everybody. Welcome back. Now we're going to talk about what happens during pregnancy to mom. So, pregnancy is a serious time for change in mom's body. She's going through hormonal changes and physical changes. Well, those hormonal changes are causing a lot of physical changes in mom. The probably most prominent one would be that large uterus that she is building. Her pubic symphysis is going to be relaxing, so it's going to be opening up wider. She's probably going to end up having a larger lumbar curve, which is going to cause some back problems, and that is known as lordosis when you have that accentuated lumbar curve. Here is the pre-pregnant uterus size as mom's growing baby, or as mom is growing a baby in her uterus. That uterus is enlarging. And if you notice, it's not really showing greatly here, but you can see her pre-pregnant breasts are smaller and the areola are a lot lighter. So as mom's moving through her pregnancy, her breasts are enlarging and the areola are getting darker and darker. So by the time she is 9 months, that uterus is hitting the diaphragm almost. So it's way up here. And so it's going to be harder for mom to breathe. Any food that was in her stomach is going to possibly cause heartburn because her stomach is so squished, which is why it's oftentimes easier for mom to eat smaller and less acidic types of foods. Also, if you remember, your bladder is right down here, and so this uterus is pushing on mom's bladder, so her bladder is getting very, very, like getting a lot of pressure on it. So any small amount of fluid in the bladder is going to cause her to feel like she has to urinate. And she also has all those intestines that are being pushed on, which is going to cause intestinal issues, specifically constipation. So mom's going to feel very uncomfortable by the end of her pregnancy, which is why most women are ready to give birth at the end of their pregnancy. In the beginning of the pregnancy, there's going to be a lot of changes as well. So initially, you're going to have morning sickness. Morning sickness is typically associated with the high levels of progesterone and estrogen. And it's oftentimes associated with things that aren't as good for the baby or that the baby doesn't need slash want. So maybe certain foods are going to be considered a turnoff because they're not good for the baby. Whereas other things you're going to crave, maybe you'll crave, I don't know, tomatoes. That's something I craved when I was pregnant once. And those are things that maybe you're lacking the vitamins in your body. And so that's one of the reasons you might have cravings. And like I said, towards the middle to end of pregnancy, you're going to be suffering from heartburn and constipation because of the growing uterus and because those hormones are also going to cause changes in your digestive tract motility. Urinary system. So the kidneys have to work double time. Think about it. You're giving the baby all these nutrients, but the baby is giving you waste, garbage that your body has to process. So the kidneys have to process not only your waste products, but now the waste products of the unborn child. So that's going to cause a lot more problems or a lot more stress on the kidneys. So they have to work a lot harder. And you're going to be compressing that bladder, causing more problems with having to urinate more frequently and potentially having bouts of incontinence that are associated with that pressure on the bladder. So you might cough, sneeze, and that can cause you to release urine. Respiratory system, you're going to be breathing heavier. You have to breathe more because now you're getting oxygen not only for your body, but for that newborn, or for not newborn, for that fetus that is growing. So you're going to need more oxygen, and that's going to increase your respiratory rate, which also will cause your blood pressure to also likely have to rise slightly. You're also towards the end of pregnancy going to feel uncomfortable breathing. So, and that's because that uterus is pressing up towards that diaphragm, so the diaphragm can't move down as easily. So it's going to be, you're going to be out of breath more often. You're not going to be able to take in as deep of breath. So you're going to be breathing harder towards the end of pregnancy. Cardiovascular system, like I said, if the respiratory system is working harder, then your cardiovascular system also has to work harder. You're going to have an increase in blood pressure. That increase in blood pressure is going to provide not only nutrients to you, but also to that unborn child. The increase in blood pressure is also going to make make varicose veins become more common. One area where all women tend to get varicose veins by the end of pregnancy is near the anus, and that's known as a hemorrhoid. And so hemorrhoids are a big problem in pregnancy and at the end of pregnancy. So what happens to cause the childbirthing process then? So there are certain stimuli that are going to cause your uterus to start contracting. So around week 16 or 17, you'll actually start having these tiny little contractions called Braxton Hicks contractions, but they're so small that we don't tend to recognize them until closer to the end of our second trimester, which is then when we start feeling those little squeeze contractions. These are basically just irregular contractions that are preparing us for labor, preparing the uterus for labor. So labor itself is an event that occurs towards the end of the third trimester that causes the expulsion of the infant from the uterus. It is a positive feedback mechanism. So this is one of the few positive feedback mechanisms that we have in our body. And it is stimulated by different chemicals being released. So one of the chemicals in the body that tends to stimulate labor is increase in estrogen. But we also have the placenta starts releasing chemicals called prostaglandins, and the pituitary gland of both the fetus and the mom starts releasing oxytocin, the posterior pituitary. So the hypothalamus produces it, posterior pituitary secretes the oxytocin. And one of the beliefs is that these are stimulated by the maturation of the lungs in the infant. So once those lungs become mature enough, then some chemical is released that stimulates prostaglandin and oxytocin release. So let's look at what's going on. So this is a positive feedback mechanism. It's going to push mom farther away from some set point until she snaps back. So baby is moving deeper into the birth canal. So this is going to put pressure on the cervix. There are receptors on the cervix that stimulate the hypothalamus to tell the posterior pituitary to release oxytocin. So there we see those pressure receptors in the cervix get excited. They send a signal to the hypothalamus. The hypothalamus tells the posterior pituitary to release oxytocin. Oxytocin is then released. And when the oxytocin is released, it binds to receptors on the smooth muscle of the uterus, which causes contractions. So that stimulates those contractions. Contractions occur, pushing the baby's head towards that cervical canal. The prostaglandins cause the contractions to become stronger and harder, and they last longer then. So what are the stages of labor? There are 3 basic stages. The first is called dilation, and I found this. I thought it was kind of cute. A way to look at the stages of labor in an mom by looking at pumpkins. So here's stage 1, or here's dilation stage, and here's 1 centimeter dilated, 2, 3, and so we have to get to 10 centimeters dilated. So we go from this all the way to this, and once the cervix is dilated to 10 centimeters, then we can actually push that baby out. Okay, so this is the longest stage of labor. It is also the stage that tends to be most different in from one pregnancy to another and from one individual to another. So for one person, you might hear a story about how they were in labor for 20 hours. And you might hear from another person they were in labor for 4 hours. So it really does differ. If it is the first child, then you're going to typically be in labor for longer. If it is a second or a third child, then it's going to be much shorter. And so here we can see that dilation stage. This is that cervical opening. The baby's head keeps hitting down here, and that's going to cause that cervix to widen and widen and widen until we hit 10 centimeters. The second stage is the expulsion stage. This stage can last from anywhere between, an hour or 2. If it's your first child, it typically will last longer. But if it's a second or third child, it can be as quick as, a few minutes. And the way most babies are delivered is head first. So if you have a breech presentation, typically the doctor will try to get the baby to turn before you're before you go into labor. And so here's the expulsion stage. The head's going to come out first. Once the head comes out, typically the body can follow relatively easily. And this makes it look like the baby is just all relaxed. So this is stressful on mom, but it's also very stressful on the baby. The last stage of labor is placental stage. So though it doesn't even seem like there's anything going on, if mom's already given birth, she's probably relaxed. They're saying, okay, we need to get the placenta out, and they're pushing and they're getting that placenta out. It's a very important time, because if any fragments remain in the uterus, any fragments of the placenta remain in the uterus, that can actually cause mom to bleed out. So remember, the placenta is attached to the mom and to the baby by the umbilical cord. If the placenta remains attached, then mom is going to bleed out very rapidly and she could die. So it's very dangerous. And so here's that placenta. They're going to make sure that the placenta is completely scraped out of there, and through that cervical canal and the vagina. And then once they have that done, then mom is done with her delivery. Okay. Hold on one second. I want to see how far I've went. There's only a few more slides, so I'm just going to make this into probably a 20-minute video, okay? So gender is determined by dad. The reason gender is determined by dad is because mom only has 2 X chromosomes. All females have 2 X chromosomes. whereas all males have an X and a Y chromosome. So if a female can only give an X chromosome, then she can only produce females. A male has to give a Y chromosome to produce a male, or an X chromosome to produce a female. So both male and female reproductive structures are identical until about week 6. At around week 6, that's when duct systems start to degenerate and to form. And by about week 8, you'll actually be able to see the different gonads. So anything before week 8, you wouldn't really be able to tell sex in general. And the chemical that stimulates male or female structures is testosterone. And so if there's a Y chromosome, on that Y chromosome is a gene called the SRY gene. And the SRY gene is what's going to be stimulated to produce testosterone. So if the SRY gene gets stimulated, so you have a male, then testosterone is released, and that stimulates the production of the male duct system and the degradation of the female duct system. Otherwise, if no testosterone is released, then the female duct system is produced. And so the reproductive system in the infant is inactive. It stays inactive until we hit puberty. Around puberty is when that reproductive system becomes active. And that can be anywhere between 10 years old to 15, 16 years old. It just depends. In males, the reproductive or the puberty is going to stimulate enlargement of testicles, and that enlargement of testicles is going to stimulate the production of sperm. In females, budding of breasts, so you're going to produce those breasts, and then your menstrual cycle is going to signal that that development of puberty or onset of puberty. So for females, when you have had an entire year without menstruation, and this is after without being pregnant, because obviously if you're pregnant, you're not going to have menstruation in general, then the ovaries, that means the ovaries have stopped functioning and you no longer are able to bear children. So this is known as menopause. And when you finish menopause, you no longer have to worry about menstrual cycles or anything like that. For males, there's no menopause, no male menopause or anything like that. But as males age, they do decline in the amount of testosterone they have. The last thing we're going to talk about then is birth control. So birth control or contraception is a mechanism to protect you from getting pregnant. The most common type of birth control is the pill, but the pill only protects against pregnancy. It does not protect against sexually transmitted diseases. There is a morning after pill, which can be taken up to 3 days after having intercourse. And this one will disrupt mom's hormones, and that will prevent fertilization from being able to occur. There's also other types of birth control, like the that cause thickening of the cervical mucus, which then keep the sperm from getting through. So Norplant is an example of a hormonal birth control that causes thickening. The mini pill or progesterone only pill is also one that causes thickening of the cervical mucus. IUDs are devices that are implanted in the uterus. And so these do not stop fertilization, but they prevent implantation of the blastocyst. And then you can do something like tubal ligation, where you cut and cauterize the uterine tubes, or vasectomy, where you cut and cauterize the ductus deferens. So those keep you from releasing the egg or the sperm to the ovary, or to the uterus, or to the ejaculatory duct. They don't stop you from having intercourse. But none of those are going to protect you from sexually transmitted diseases. So just remember that. Coitus interruptus is the withdrawal reflect, and it's not a very effective mechanism, because if a male is excited, a lot of times he will have some sperm and semen at the tip of his penis already. So even if he withdraws, he might still get a few thousand sperm in the vaginal canal. The rhythm or the rhythm method, you're looking at your ovulation time, and so you're watching for when you are fertile, because the egg can only last for about 24 hours. So if you stay away from intercourse for about 48 hours prior to and 48 hours after ovulation, then again you can protect yourself from having or from getting pregnant. But again, this method is problematic as well, because there are some sperm that are called super sperm that can live for a little bit longer than just 2 days. And so things that are a little bit more protective against disease as well as pregnancy would be your barriers, like condoms and diaphragms. These are going to protect you a little bit further. Condoms are probably one of the most common methods. They protect from pregnancy, and they also protect from many of the STDs that are out there. Cervical caps and diaphragms can protect from pregnancy, and they can also be a little bit protective of certain types of diseases. Spermicides are often used with condoms, so that any sperm that might get out are going to hit that spermicide, and then they're going to die. The spermicides are also used with diaphragms and with caps. Abortion is the termination. So this is not preventing pregnancy. This is terminating a pregnancy. And abortion is just the termination of a pregnancy. This occurs typically in the first trimester. A miscarriage is a spontaneous abortion, and this typically, again, occurs in that first trimester, and oftentimes, most, in fact, miscarriages occur within the first 8 weeks of pregnancy. A lot of times prior to mom even realizing she is pregnant. So she has a period, she gets pregnant, and she doesn't even realize, because by the time she would miss her period, she has a miscarriage. So she's only like 5 weeks along. She has a miscarriage. She might think, whoa, I was a little late, but oh, here it is. Most spontaneous abortions are caused because of chromosomal abnormalities. And so the child wouldn't be able to survive. And then there are pills that can also induce abortions for individuals that are carrying a child, and maybe they were carrying a child that I don't know. I won't go there because that would be more controversial. So RU486 is known as an abortion pill, and it can stimulate a spontaneous abortion. And so this is just kind of a table that shows those different mechanisms of preventing pregnancy. A lot of these later mechanisms, not the morning, or not the pills, but the condom, the condom with the spermicide, or the diaphragm with the spermicide, those can also protect from certain diseases. So there's just a picture of those different structures or different things. And so we have finished this chapter. So the last study guide questions that you should be able to answer now are: what are the physiological changes that occur in mom during pregnancy? What is labor? What stimulates labor? What are the stages of labor? When is gender determined? When does puberty begin? What is menopause? And what are the different types of contraception? I'll stop here. This was a very long video, but we're done now. So congratulations on making it through the entire semester. Bye.